Mpox is a disease that comes from a virus. It is important to understand this illness. Animals can pass the virus to people. People can also spread it to other people. This means it can move between humans. There are two main types, or clades, of the Mpox virus. These are known as clade 1 and clade 2. Scientists consider clade 1 to be the more severe type. It can sometimes lead to more serious health problems. Knowing about these types helps us understand the risks. The world is paying close attention to Mpox. In August 2024, the World Health Organization made an important announcement. They declared Mpox a public health emergency of international concern. This highlights how serious the situation can be. Currently, there is a significant outbreak of clade 1 Mpox. This outbreak started in Central Africa, especially in the Democratic Republic of the Congo. Since January 2024, thousands of cases have been reported there. This situation requires careful monitoring and response from health authorities globally. The clade 1 Mpox virus has not stayed only in one region, it has spread to other parts of the world. This spread often happens through international travel. We have seen travel-associated cases of clade 1 Mpox in Africa. Cases have also appeared in Australia, Europe, Asia, and both North and South America. In the United States, a few clade 1 cases were found between November 2024 and February 2025. These cases were linked to travel from Africa. Health officials state the risk to the general U.S. population is currently low, but vigilance is key. It is very important for everyone to be aware of Mpox. Understanding this virus helps us protect ourselves and our communities. Knowing the symptoms is the first step to early detection. If people can recognize Mpox early, they can seek medical help quickly. This can also help prevent the virus from spreading further. Learning how Mpox spreads helps us take the right precautions. Information about prevention and treatment empowers us to make informed decisions about our health and safety in these times. When a person gets Mpox, certain symptoms usually appear first. These early signs can include a fever, which is a high body temperature. A headache is also a common early symptom. Many people experience muscle aches all over their body. Backache or significant back pain can also occur. One of the distinctive early signs of Mpox is swollen lymph nodes. These are small glands in your body that can become enlarged when you are sick. These initial symptoms signal that the body is fighting an infection. Other early symptoms can also develop as the illness begins. People might feel chills, even if the room is not cold. A strong feeling of tiredness or exhaustion is very common. This can be described as having very low energy. Some individuals may also develop a sore throat. These symptoms usually start about 1 to 21 days after a person is exposed to the virus. It is important to pay attention to these signs. If you experience a combination of these symptoms, it is wise to think about potential exposures and consult a healthcare provider. The most recognizable symptom of Mpox is a rash. This rash typically develops within 1 to 3 days after the fever starts. However, sometimes the rash can appear even before the fever or other symptoms. The rash often begins on the face. From the face, it can then spread to other parts of the body. This can include the palms of the hands and the soles of the feet. The rash can also appear inside the mouth, on the genitals, or in the eyes. The location and spread pattern are key features. The Mpox rash goes through several distinct stages. It starts as flat spots called macules. These spots then become raised and firm, known as nodules or papules. After this, the spots fill with clear fluid, forming blisters or vesicles. Then the fluid turns yellowish and they become pustules. Finally, these pustules dry up, scab over, and the scabs fall off. This whole process can be itchy or painful. The illness usually lasts for 2 to 4 weeks. For people with weak immune systems, symptoms might last longer and could be more severe. Mpox can spread from one person to another in several ways. A primary way it spreads is through direct contact with the infectious rash. This means touching the sores, scabs, or body fluids of someone who has Mpox. If these materials get onto your skin, you could become infected. This type of close physical contact is a significant route of transmission. Therefore, avoiding direct contact with the rash or any fluids from the lesions is very important. This helps to prevent the virus from entering your body through small breaks in the skin or mucous membranes. Another way Mpox can spread between people is through respiratory secretions. This happens during prolonged close face-to-face contact with an infected person. When someone with Mpox talks, coughs, or breathes very close to you for a long time, tiny droplets containing the virus can be released. If you breathe in these droplets, you could get infected. This is why being in close proximity to an infected individual for extended periods carries a risk. It is different from brief encounters. Shorter interactions are less likely to result in transmission through this route, but caution is still advised. Intimate physical contact is also a known way for Mpox to spread. This includes activities like hugging, kissing, cuddling, and sexual contact. During these close interactions, there is a high chance of direct contact with the rash, sores, or body fluids. Mpox can also spread by touching materials that have been contaminated by the virus. This includes things like clothing, bedding, or towels that an infected person has used. The virus can survive on these surfaces for a period, posing a risk if someone else touches them and then touches their eyes, nose, or mouth. Mpox can also spread from animals to humans. This often happens through direct contact with infected animals. If an infected animal bites or scratches a person, the virus can be transmitted. Preparing or eating meat from infected animals, sometimes called bushmeat, is another way people can get Mpox. This is particularly a risk in areas where the virus is common in wild animals. Direct contact with the body fluids or lesions of infected animals can also lead to infection. This includes touching sick or dead animals found in areas where Mpox is known to circulate. Vaccination is a key tool in preventing Mpox infection. There are vaccines available that can help protect people. For example, the Jynneos vaccine is used in many places. It is a 2-dose vaccine, meaning you need to get 2 shots for the best protection. The second dose is usually given about 4 weeks after the first one. Vaccination is often recommended for people who are at higher risk of being exposed to Mpox. It can also be given to people who have already been exposed to the virus to prevent the disease or make it less severe. Beyond vaccination, simple everyday actions can help prevent the spread of Mpox. Good hygiene is very important. This means washing your hands regularly with soap and water for at least 20 seconds. If soap and water are not available, you can use an alcohol-based hand sanitizer. It is also a good practice to disinfect surfaces that are touched often. This includes doorknobs, light switches, and countertops. These simple steps can significantly reduce the risk of picking up or spreading the virus in your home and community. Avoiding direct contact with people who have Mpox symptoms is crucial. If someone has a rash that looks like Mpox, or if they feel unwell with other Mpox symptoms, try to keep a safe distance. You should also avoid touching their clothing, bedding, or any other personal items. These items might have the virus on them. In areas where Mpox is found in animals, it is important to be careful. Avoid contact with wild animals, especially those that seem sick or are found dead. Travelers to regions with ongoing outbreaks should take enhanced precautions. Currently, there is no specific cure for Mpox. Medical care for Mpox is generally supportive. This means treatment focuses on relieving the symptoms and making the person more comfortable. For example, doctors might provide medicine to help with pain or fever. They also work to manage any complications that might arise, especially in severe cases. For some individuals, antiviral medications like tecovirimat may be considered. These are usually reserved for people who have severe disease or are at high risk of becoming very ill, such as those with weakened immune systems. If you think you have symptoms or have been exposed, see a doctor promptly for advice. Early detection and appropriate care are vital.